What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, July 29th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. There's a lot of different viruses out there. You need to be informed with what's going on with them. You need to be informed with what's spreading in your community where you live. That's my job. I help keep you informed on latest case levels of COVID, flu, RSV, and all the other viruses. As I find data and do the research, I bring the information to you because we want you to stay safe. No one wants to get infected by COVID, but let's face it, here in 2024, COVID is still a thing. The pandemic did not end because death levels, once again, in another surge of COVID, are going up. Yes, more people are starting to die of COVID again. Deaths have been increasing. We'll see more on that in today's update. We'll see some other things in today's update as well. Want to stay informed with what's going on? Subscribe to my channel down below. Give this video a thumbs up, and remember to hit that notification bell. You'll be notified when I do my daily updates, and of course, leave any comments you may have down below. Alright, starting off today with the Olympics. The Olympics are going on over in Paris right now, and there's an increasing number of people getting sick. This go round it is for COVID. Adam Peaty, who is from Britain, Great Britain, swimmer, did test positive for COVID. They did not announce what variant it is, and also a Ukrainian tennis player also is sick at this time, but that is not for COVID. They're claiming that is a cold at this time, so we'll have to find out if anything else comes out about that. But as you can see here, there have already been several news stories. It all started off really with the water polo team from Australia, and then it's gone on from there, and given we are only into the first Monday of the Olympics, I think we are going to see several more people get sick, and I think we'll see several more people end up being positive for COVID. Alrighty, moving on. Usually on Mondays we would do the update from New Zealand. I've looked for news stories, and I've even gone to New Zealand's website. I do not see any update from them. They did not update this week so far. Hopefully we will get something for them from COVID. Now on to this. This is coming from Jammer on X, and I think this is a fantastic post. It says, Tale of Two Stories. July 24th, Comic-Con is finally back to normal. July 28th, Comic-Con creators come down with COVID. This is in San Diego, and as we know, or maybe you don't know, if you're new here and you haven't been following along, California has been in a significant COVID wave at this time, and anything being done in California right now, despite the fact that, yes, they're peaking for COVID, transmission levels remain very high. So anything being done in California, such as this, which would be a larger gathering, it's not necessarily safe right now because COVID can spread very easily when you have transmission that's high. So any large gathering, you're likely to see someone who is positive with COVID. And it says here, San Diego sustains significant rise in COVID. Attendees, including creators, isolate in hotels after testing positive for COVID. So, legitimately, yes, this is a COVID outbreak, and yes, this should make it to my COVID outbreak archives, and I think it probably will make it to my COVID outbreak archives. I'll be updating that later in the day today. Okay, let's move on now. South Korea. Hospitalized COVID-19 patients up more than threefold in 1 month. Significant simultaneous outbreaks of pertussis and mycoplasma pneumonia also are occurring. So, yes, South Korea, you're also seeing a rise. There's a lot of countries right now, not just the United States, all around the world that are seeing rises for COVID. Luckily, some of them have peaked, but many more have not and are still rapidly rising, such as South Korea. First time we've talked about South Korea in quite some time, and unfortunately, it is not for a good reason. All right, time now for the BNO News weekly U.S. COVID update. We share what they post each and every week. We've been doing it for quite some time now, and unfortunately, That's not good. Things have gone even higher. New cases are estimated to be 141,506, and these are reported cases, not including at-home tests, not including those who don't bother to test, and not including what the level is suggested by wastewater, which we know is many times higher than that number. The average is now 121,018. That is up by 13,161. In the hospital, 3,872. That's up by 289, though be it the hospitalization number looks like it's going to be peaking lower than what it was last year. Mind you, many hospitals don't report. We'll get into that in just a moment. In the ICU, up by 35 to 402, and new deaths, another 539. The average is now up by 17 to 510. Note, they do note, limited data, and they'll explain more in a moment. The COVID summer wave continued to grow at a gradual pace for the 8th week in a row. Some areas may be at or near their peak for this summer, though it varies by state. And we do know Florida is probably near or at their peak right now. California is in the process of peaking. Some other states in the West Coast are peaking. We'll get to that in a little bit because we got some interesting Walgreens data coming in just a little bit. Let's continue on here. The most notable increases this week were reported in Texas, 61% increase. West Virginia, 52% increase. Maine, 42% increase. Colorado, 28% increase. Tennessee, 26% increase. New Jersey, 25% increase. And Kentucky, 24% increase. Only 33.9% of hospitals reported this week in the U.S. So, only 33.9% of hospitals in the U.S. submitted COVID data this week, which is slightly down from last week and down from 91% in May. This means actual case numbers and hospitalizations are higher than reported. So, while they probably are higher than reported for hospitalizations, still could be lower than what was reported last year. This is the third week in a row with more than 500 new COVID deaths in the U.S., or 1,631 during the same period. And I got a feeling we're going to fall into this pattern where we're above 500 for many, many weeks. Remember last year it was 1,000 deaths. This year it's 500. And who knows? We could go above 500 to 6, 7, 800. Because remember, deaths do lag hospitalizations and every other metric. So the worst of this death wave for our current wave is likely yet to come. It's also the 228th week in a row with more than 400 new COVID deaths, or nearly 1.2 million deaths combined. So far this year, more than 4.1 million COVID cases have been reported in the U.S., causing at least 315,291 hospitalizations and 33,679 deaths. Let's think about that for a second. There's no other virus of this type, respiratory virus, that's causing that many hospitalizations in the United States right now. I mean, 315,291. That's not including the ones that weren't tested, the ones that weren't reported, or we just don't know about, or the people that did not bother to go to the hospital and just suffered and died at home from COVID, because that has been a thing throughout the pandemic as well. So, yes, 315,291 hospitalizations still this year, and we are only entering August with a few more months to go in the year. My friends, that is still a pandemic. That is one of the big reasons why we put in our thumbnail every day on this channel that COVID, the pandemic, is not over. Every day you see that thumbnail that says the pandemic is not over. We still call this the pandemic update. Because look, that is a heck of a lot of hospitalizations in 1 year for a virus. It's unacceptable that it's that high. It's something that can be prevented. We could get that significantly down if more people masked and took this seriously, or wore the proper type of mask. Alright, moving on now to our next thing that we have to look at, and that is pollen levels. We can see here, the National Allergy Map, drumroll please, remained the same as yesterday. We can see here there are more oranges showing up than we have seen in quite some time, and there's also a lot of yellow. There is some green in the southeast, green in New England as well. They're seeing some showers and thunderstorms today. That's what's keeping that down. But here's something that is not down, and it is a real problem all across the United States. Not in every portion of the United States, but a large portion of it. And that is air qualities. Take a look here. Even all the way down along I-95 into Florida now, air qualities are starting to get bad. It's orange, and you're seeing yellows, and more so oranges now. Pennsylvania, we've been smelling the wildfire smoke here, up to the north as well. But then we go out to the west coast where all the wildfires actually are, and well, you're seeing reds, you're seeing purples, not good. And might I recommend, if you're in those areas, consider wearing a mask. Just consider doing it, because you do not want to breathe in that bad air quality. It is bad for your lungs, especially if you have breathing difficulties. You don't want anything to do with that. You actually want to limit your time outside. All right, moving on to something else that is a problem. Last week, there was a little bit of a surprise. Take a look at New England for heat-related illnesses. Yeah, look at the state of Maine. Much higher than average in the majority of the counties in Maine, New Hampshire, Vermont, even portions of upstate New York, Delaware, Maryland. Yeah, this is not looking too good here. Pennsylvania's not doing bad. New Jersey's not doing too bad, but New England, I'm concerned about that. Look at Maine. They've had a lot of heat-related illness calls. Florida, it's typical for the summertime. North Carolina has seen a few. West Coast, I want to say, yeah, it's still going on, but it could have been a lot worse. Now what I think we're going to see is, and it's not going to be shown on this dashboard, we're going to see a lot of respiratory emergencies going on out in the West Coast with these wildfires and the wildfire smoke. It is going to cause an increase in respiratory emergencies, and the rest of the country just scattered. Some counties are doing bad. Other counties are around average. So not terrible everywhere, but I'm really concerned about how many heat-related illness calls there are up in Maine, New Hampshire, and Vermont. That's concerning to see it being much higher than average. Want to learn more about the climate and weather? I'll be tweeting later on today over on my Weather X Climate Data Report. So go check that out. And also, I will probably have another video at some point this week on my other YouTube channel, Climate Data Report. Subscribe to that one. There will be a link to it down below. All right, Philadelphia yesterday. Some good news. Much less EMS incidents than Saturday. Remember, it was way over 900 on Saturday. Yesterday was 770 EMS calls. So good to see that number lower. Speaking of Philadelphia, before we do our live look at EMS, I wanted to show this to you. Let me refresh this real quickly. Take a look at this. This is SEPTA. This is the mass transit line in Philadelphia. It's the Mass Transit Agency. It stands for Southeastern Pennsylvania Transportation Authority. I want to show you something here. Look at this. 24 minutes ago. Route 43, that would be a bus. Operator unavailability. And you can see here. Broad Street subway line scheduled 404 and 549 southbound local trip from Fern Rock Transportation Center is canceled due to operator unavailability. And on it goes all day long. Look at all these different operator unavailabilities across several different buses, subways, and different routes. Yeah, something's clearly going on. Could it be that COVID virus going up again in the summertime? Could it be staff shortages? Yeah, all these things are topics that we have covered on this channel at some point or another. Doing a live look in right now at what's going on in Montgomery County. A little busy there. 15 calls right now. Cardiac emergency, cardiac arrest is showing up. Taking a live look in at Chester County, Pennsylvania. We do see respiratory emergency, sick person, falls, injured, heart problems, and diabetic emergency. We'll get a deeper, detailed update on Pennsylvania tomorrow when we get an update on Pennsylvania wastewater. All right, drum roll please. The new Walgreens update for this week for COVID. It's kind of a mixed picture, and there is a surprise twist in this. That surprises. Testing went up once again. Yes, more people are going for a PCR test or a test in general for COVID at Walgreens. Current week's positivity rate is 39.4%. The prior week is 39.6%. Difference of down 0.2%. Total test 8,132 versus 7,637. And I don't want to say Walgreens has peaked yet, because they may have, but if testing starts to drop in the coming weeks, we may see that positivity rate go up a little bit higher. But hey, if testing holds steady and cases do start dropping, then hey, maybe we can start talking about a peak. But again, we do have a mixed picture here, and even in places that are supposed to be peaking right now, you're going to see there are some really high positivity rates and even some increases. We just talked about Pennsylvania. Let's start there today. Pennsylvania, the positivity rate. This is not good. 41.5% this week. 34.7% last week. Difference of up 6.7%. Total test 82 versus 72. It's late July. We're about to enter August. Pennsylvania, it's that time of year we tend to see a COVID surge. Ohio continued higher this week, but their testing did drop. 38.1% positivity rate this week. The prior week was 30%. That is up 8.1%. Total test 113 versus 140. Positivity rate. Maybe cases are still going up, but again, with that testing decrease, that might be a part of the problem as well. Louisiana, you still continue to rise. You got a real problem here. 43.4% COVID positivity rate. The prior week was 34.3%. Difference of up 9.1%. Testing went up as well, 122 versus 99. Now I'm going to show you something that's not good at all. Washington State, 57.1% positivity rate. The prior week was 32.2%. Difference of up 24.9%. And I get it. Your testing is down 28 versus 59. Even at that, you should not have an increase this high. Something is clearly wrong with this picture. You're still dealing with high transmission. Yeah, you may have peaked, but the levels aren't dropping all that much if your positivity rate went that high. Let's go down to California. We'll end Walgreens on a positive note. And the positivity rate in California is 41.1%. That is down by 5.5%. And the prior week was 46.5%. Total test actually dropped. 185 versus 303. And you know what? I'm feeling generous. Let's go one more with Walgreens, because we didn't do much in the way of the Great Lakes. Michigan, the positivity rate is 40.7%. Prior week is 43.4%. Difference of down 2.6%. Total tests 108 versus 143. We'll look at more Walgreens COVID positivity rates in various different states again tomorrow. Let's take a look at what's going on in Canada at this time. High COVID viral activity detected. Flu A and Flu B are moderate, and RSV is low at this time. We haven't said much about RSV lately. When I do my searches today, I'll have to remember to check RSV to see if anything comes up. You never know. We were talking about Pennsylvania a moment ago. I want to show this to you. This is relatively interesting. This is a wastewater site in Center County, Pennsylvania. Mind you, the college students are not back at Penn State University yet. Look at that wastewater for COVID. Yeah, that is quickly going up. Don't like seeing that. Just a couple weeks ago, you had Arts Fest, and you also had People's Choice, which is another big event there. I don't know. State College, Pennsylvania area. If you happen to be headed up there, please remain extra vigilant. All right, New Jersey today, 412 hospitalizations, and that's with only 58 out of 70 hospitals reporting. That's a concerning number to see with so few hospitals reporting. 12 people on a ventilator. In the ICU, 41 at this time, and 46 discharges. New York State today does report that looks to me, look at this, looks to me as if cases may be trying to slow off a little bit. But remember, there is that KP.3.1.1 variant. We'll have to watch. Some say it could allow things to just level off and then delay the drop. So we'll see. I don't think they're going to go much higher in New York State, but only time will tell. 1,946 new cases added back on Friday. And taking a look at hospitalizations, I do expect they will go up higher again tomorrow. But for today's report, it says 1,116 in the ICU, 103 at this time. Alrighty, folks, that does it for today's pandemic update. Boy, we sure learned a lot today. We learned, if we go back here, we learned that so far this year, there have been 315,291 hospitalizations so far this year. I think that still classifies this as a pandemic. Still 33,000 deaths. That's more deaths than flu, so you can't say, oh, it's just like the flu. Well, no, the death rate and hospitalization rate is still higher than the flu. We need some more treatments. We need some more methods to help get these numbers down in future years or in future waves. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. We'll have another one again tomorrow. If you enjoyed this update, give it a thumbs up, subscribe to my channel down below, hit that notification bell, share these videos with anyone you know, because let's be honest, we need to keep more people informed of what's going on. And of course, I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday evening. Thanks for watching.